Now, today is the 10th day of September, the year 2024. Of course, all over the world, there's a lot of focus today on prevention mechanisms around the question of suicide. So here in Kenya, there have been calls for decriminalization of attempted suicide in the country. We saw renewed calls today on Tuesday as Kenya joined in the world in commemorating World Suicide Prevention Day. Speaking during the commemoration of the day here in Nairobi, Kenya, health experts and attempted suicide survivors decried the continued stigma, calling for open discussions on suicide as well as suicidal behavior in line with this year's theme of changing the narrative on suicide. Start the conversation. Joseph Wakhungu with the details.
I was in addiction for over almost 20 years.
Stephen Odhiambo is a suicide attempt survivor. His is a tale of how hopelessness arising from a prolonged battle with drug abuse almost drove him over the edge.
My life basically became hopeless, and I felt it was better to be dead than alive.
He narrowly escaped, adding to the statistics of those who have taken their own lives after failing to get the necessary support in good time. Stephen's story resonates with that of thousands of young people in the country, aged between 15 and 29 years.
It's not a good thing when we can lose vijana, and most of the people who are losing their lives are actually young people to suicide.
Suicide ni gonjwa kama lile gonjwa lingine. Kwa hivyo unaweza enda kwa hospitali ukapimwa na ukatibiwa na ukapata matibabu.
According to data from the World Health Organization, suicide is ranked as the third largest leading cause of death among the youth.
Because most youth, what is making them get into suicidal ideation is when you're not able to afford the things that you currently want.
As the world commemorates World Suicide Prevention Day, stakeholders gathered in Nairobi to pick up the pace on discussions around suicide and suicidal behavior, with calls to enhance the response, time and assistance, create awareness and end stigma.
We are encouraging all men or gender, the male people, to be able to talk about their issues. Most men don't want to talk about it because of fear, others stigmatization. And now we have an anonymous calling where you can call and nobody will know it is John who is calling or it is Joseph who is calling.
With clear data on suicide rate in Kenya not available as several cases go unreported, experts revived the push for legislators to decriminalize attempted acts of suicide.
Let's not use the word committed suicide, because we don't say committed diabetes or committed cancer. We say that person died from cancer. So once we change that narrative and say this person died from suicide, then we are looking at it as a symptom of a disease. And if it's truly a symptom, what needs to be done is treatment.
Joseph Wakhungu, Prime Edition.